The continuous increase in COVID-19 cases in Nigeria over the last week is becoming very worrisome. While some analysts and critics are of the opinion that the federal government of Nigeria must increase efforts towards curbing the spread of the pandemic through measures which include a possible lockdown, others have come to the conclusion that take it or leave it, Nigerians must learn how to live with the virus. Chairman, Presidential Task Force on COVID-19, and Secretary to the Government of the Federation, Boss Mustafa, had last week debunked rumors of another possible lockdown in Nigeria over the COVID-19 pandemic. So what could be a solution to the rapid increase in the spread of the coronavirus apart from another lockdown? Joining us now to look at this issue is Dr. Oladapo Asiyanbi, a public health and sustainable development expert and a member of the Lagos State chapter of the Association of Public Health Physicians of Nigeria. Dr. Asiyanbi is currently the Medical Officer of Health and Coordinator, Lagos State Primary Healthcare Board. Welcome to the program, Dr. Asiyanbi. Good to have you with us.
Thank you very much.
Yes, well...
I'm glad to be here.
Yes. Well, quickly, I mean, the federal government and the state governments have been easing the lockdown in Nigeria in various ways. And we're told that the Presidential Task Force is not thinking of enforcing another lockdown in the event of an exponential rise in the numbers of infection. And of course, we're beginning to see that sharp rise now, although that is attributed to the fact that with the lockdown, the numbers will rise anyway. What's your take on this? Do you think that at some point the government may need to impose another lockdown to save the people from themselves, or the people should take responsibility for their own lives?
Thank you very much. Let me first make a slight correction. I'm not the coordinator of the Primary Healthcare Board. However, your questions are very simple. One, people will only take responsibility for their lives. No government can take responsibility for people's lives. The best approach to this, one, is we cannot afford a lockdown. Nigeria does not have the human resources, the financial resources. We do not have the time. We do not have the money. We do not have the materials. When you talk about human resources, if you want to put a lockdown, then you must enforce it. We have less than 400,000 policemen. If you add the army, they're not up to 1 million. And you want them to police 250 million people. And we have other larger security threats around. And then there is a 50% poverty rate. No, it won't work. We can't afford it, and the people are going to revolt. And so, what should we do? We need to bring the response, bring it closer to the people. The response for now is too central. At the presidential level or at the state level, it's too far. People live in communities. Even the Aso Rock Villa is in a local council, one of the 6 in Abuja. So the response should just be decentralized to a local community level where the people will be able to meet closer to that level of governance, and then they will be able to sort out issues of being self-responsible. So in this case, government will be working with the people. Government will have to do the response with them, what we call a do-it approach. What we are doing now is a do-for approach. And the expectation of the people are too high with a do-for approach. But with a do-it approach, they will collaborate at the community level in every local government. There are 774 of them. And I believe that will move the response to a more responsible and profitable, protective, preventive, cooperative level.
I'd like you to expand more on this not do with, do for approach, please. And another question I have for you, on the 1st of June, the Presidential Task Force on COVID-19 announced this gradual easing of the lockdown and said they will review it in 4 weeks. What would you like to hear from them at the end of June, beginning of July?
Well, let me start with the most important part. That is the approach of do for versus do it. If I want to feed you and I bring a diet that is strange to you, so you're a Nigerian, then I bring you salami and I bring you pasta Then I add all the casserole and all that. But what you eat is simple ofe onugbu or amala. If I like, let me pack 17 of that or a whole carton. You will just be looking at me as if I've done nothing. So the first thing I should ask you is, are you hungry? You say yes. What food would you like to eat? You will say, this is the type of, okay, can you find it locally? Fine. Then find a friend who can give it to you, I'll pay. And then you do it. Simple and short. It goes straight to the point. But if you bring everything from somewhere that looks esoteric, you want to even talk to government, it's too far off. They're going to have challenges. But if you have it at the closest level to them, which is at their ward level, where you have a councillor, and at the LGA level, you're going to get their cooperation faster because they're going to be able to give feedback faster, sooner, and it will be more understood by that level of government because they live within that community. Now, going to the presidential task force, I think they should just know that at every level of governance, lockdown cannot be sustained. So let them ease it, let them give guidelines, and let every single local government kind of domesticate that guideline to what will work for them. I'll give an example. In an urban, well-spaced house area, let me use Lagos as an example. Let's say somewhere like Ikoyi and Banana Island. It's in one local government in Etiosa. Then you compare them with people who live in Ikota. Apologies, I'm not trying to put them, but their standard of living, their conditions of living are separate and different. The level of understanding of the issues are different. What troubles them daily is different. So some people are able to keep the lockdown, the face mask, very fine, easily. Some people, they find it challenging because they are struggling with everyday living. They cannot even breathe. And you want them to sit at home. The air around them is not, the housing is made of nylon. So you'd have to call their own community leader and say, okay, this is the guideline the government has brought out. How do we live with this virus using this guideline, make it our own? So if they have to put a community tap or a big bucket or a drum in the community to encourage hand washing, then that would work for them. But if you have to say, yes, you all have to buy one big, you have to look for wash hand basin, they don't have drains. They don't even have where the water will flow to. So you have to teach them how to live with the virus within what is available around them, and they will know what to do. And if they see a case, they will quickly inform you. You can track, you can trace, you can treat. And so I believe that that is the way to go. And I think that with that, if you give that level of government responsibility, then you must match it with resources. Because all the things we're talking now, if you're asking a community that has no water, and you want to give them water, maybe what will work for them is somebody to bring a tanker amongst them who is a supplier. One, you help the economy because that person feeds. Two, you provide potable water at their level because you're not going to wait until Water Corporation pipes water to that area. Hand washing is key, essential, and is life-saving all the time, with or without coronavirus.
All right, very, very well said. You made mention of the local governments, and I want to harp on the local government. We've got 774 local governments.
Yes.
But it looks as though that the local governments have not taken the fight on, and they should be the key arm of government in this fight. How can we include the local government? I should think by now that people should be able to walk into their local government secretariats and get coronavirus testing as at now that we speak. That if we truly want to fight this coronavirus, the test should be made available across 774 local governments and the LCDs too in the country, because that's the government closest to the people. But now that's not the case. We don't see that. We don't even have local government-based isolation centers.
Okay, the first question is, I said response at that level. And I'm sure those who understand know that the local government are actually responding. However, in communicating with the public, you cannot have 774 incident commanders talking to the public. is going to be a cacophony of rubbish. So there is a streamlined approach to communicating with the public that comes at the level of the state and at the level of the federal government. It is not that the local government are not talking to their people. You don't see that on the press, and you don't need to see that for the response to make sense. So if there's a guideline coming from federal government, PTF, NCDS, I do not think that the local government now needs to print another guideline. They will now have 774 guidelines.
No, you're not getting my point, sir.
So,
Doctor, you're not getting my point. I'm not saying guidelines. I'm not saying talk to the public.
Okay.
I'm saying infrastructure on ground that can fight COVID.
Let me get to that.
I'm saying hospital beds.
Let me get to that.
Yeah.
So the thing is, what really is their role in this response? Their role is spelled out in international guideline and national guideline called International Integrated Disease Surveillance and Response. It's a technical guideline for fighting any emergency and epidemic. It's been there for years, for decades. And in that guideline, there is a role for the local government, there's a role for the state, and there's a role for the federal government. Now, if the local government plays its role, that means they've taken like 70 to 80%. So let's come to the testing. The testing is a bit technical, and therefore, it's what they call a reverse transcriptase polymerase chain reaction, PCR. The public may not need to know that. However, because it's technical, let me use Lagos for example. There are 4 places where you can get the test done in Lagos. You don't need to have it in 20 local governments. That's where the test will be run. But what they can bring close to the people is sample collection sites where you can walk to, they take your sample, then the local government and the state government agree on how things are done, take it there. That is in Lagos, and that is already going on.
All right, Doctor, we'll quickly go for a quick break.
Yes.
We'll come back, we'll be right back, we'll talk to you some more. All right, so we still have Dr. Oladapo Asiyanbi, public health and sustainable development expert. And you're talking very brilliantly, but I said, to a large extent, I disagree with you. And why I disagree with you is this. With all the wealth in this country, why can't local governments lead the fight? Local governments can be akin to what we call counties in America. And when you look at this fight, counties are leading the fight. Counties have hospitals where they can take the swab. I don't know what it costs to set up a molecular lab, but I think Nigeria should be able to have the capacity to have molecular lab in 704 local governments. And sir, furthermore, you forget that there are some local governments that are as big as some states or half of some states in this country. And some local governments that you take 3 hours to go to local government headquarters.
All right, now let's put this into perspective. The America that you're talking about, last month, the Congress passed a financial bill, a law, that states and local governments should be given additional allocation to be able to cope at their local level with the economy and health-related challenges that COVID has brought. Now, if you look at Nigeria's own situation, we have something similar. Everybody takes money from one pot, but there's a law that says who gets what. Maybe about 50% goes federal, another 30% goes to the state, and about 20% goes to the local government. So now, one government, the federal, takes 50. Then 36 share 30%. Then 774 share 20%. You tell me, how would you respond? On the average, after most local governments have paid salaries, I'm not sure they have something really left to do enough governance. Now, COVID has come.
That's why they generate their own money.
Hold on. I'm putting it into perspective. Now, you can go through the record and see how much the IGR cost. Put these things into perspective. If a federal government budget is 9 trillion, right? Turn that into dollar terms and see what that comes to per person for every 200 million. Now, imagine another local government has a population of 2 million and their budget is, say, 500 million? Say 500 million. You tell me when you spread that money around, what it will do. It will do nothing unless you do not want to face the reality. So they don't have the capacity as we talk now, to do enough. I didn't say they don't have the capacity to do enough if they get enough resources. They don't. Now, IGR for local governments are rates, taxes, kiosk. On the average, I'm not sure people pay more than 5. Okay, let me give you something that at least that I have a little bit of information on. Radio and TV license that every single household in a local government is supposed to pay to the local government. I'm not sure up to 5% of people do it. I'm not sure some of you are even asking me questions. I've paid 500 naira to your local government for radio and TV license.
You can't be very sure.
No, I said I am not sure. That's what I said. However, if you go to London, if you move in today, part of your rent will be radio and TV license that goes to the local government. So you see, our compliance with taxes and revenue reduces as the level of governance come closer to us. So people feel more comfortable paying the federal government because they see it as big, and then more comfortable with state, and almost nothing. They would rather not to the local government. And so we need to change that. But before that comes, for now, the special funds that are coming in for COVID as donation, my personal belief is it should be decentralized, given to the lower level of governance, tier of governance, to respond. If you have a hospital and you cannot equip it, and I do not think everybody needs to be isolated, I think we should go the way of isolating those who are severely ill as much as possible, then work at our local levels with those who are not really severely ill, with the cooperation of the community. You see, what works in Ibadan may not work in Kaura Namuda. What works in Otukpo may not work in Maiduguri. What works in Katsina may not work in Yenegua. So everybody will have to look at their local situation, plan the response with their community at that level, and then know how much resources they need. And I think that they should be able to discuss that with the state and the federal government. This is the time to support the lower tier of government to ensure that the people get the best value for money for this response.
Dr. Asiyanbi, well, in more specific terms, what do you think we really need to do to get our public health care centers, many of which are supposed to cater for the rural poor, to get them functioning again? Once upon a time in this country, we had primary health care centers, but today, most of those primary health care centers is either they've been abandoned or they no longer exist, cutting off a significant portion of the Nigerian population away from access to health care.
Yes. Wow. You see, the health system, let me look at that primary healthcare system. But the goal of every healthcare system is what we call universal health coverage. And there are 3 dimensions to universal health coverage. 1, there must be equity. 2, there must be quality of care. And 3, there must be financial protection for people who use it. Now, those 3 dimensions, every single nation state decide how they go about theirs. However, WHO has looked around and they found out that primary health care is still the simplest, easiest, closest, scientifically useful and maintainable at every stage of a country's development that will meet universal health coverage. So what do we need to do? 1, we need to look at the 6 components of the health system at the PHC. 1, get more human resources. 2, provide more financial protection, either in the areas of social health insurance that people call health insurance scheme. It's cheaper it's like pulling money together like an Isuzu, and then the cost of purchase will be less. So that is another thing. So financial protection can come through that way. Then you need to get the technology, the vaccines, and the equipment that suits their local conditions. Because there is no point buying a CT machine for a PHC, right? Where the challenge in that locality is snake bites. It's better you just go and get them anti-snake venom, and you'd have caught their problem by like 70%. So, technology. Now, information system needs to be addressed. And there are 2 aspects to the information system. 1 is routine information system, which is the data from the facility, and non-routine, which is things like surveys, researches, and even rumors. So those are the major 6 things we now. At the head of all this, I've mentioned 5, is leadership and governance. The leadership and governance at that level needs to be respected, needs to be understood, needs to be empowered, and needs to be resilient to be able to take decisions with the resources they have at that level without having to every time make recourse to a higher level of authority. Because the times in the past we were talking about, public health system was built at that level and things work. And I know that things will work again. I'm very, very confident about this country. I have so much belief in Nigeria that it is effective. And I know this country will work.
Amen. That's a great note to end on. Thank you so much for joining us this morning.